Okay. Welcome, everybody, to the Dunn County Health and Human Services Board for Thursday, April 27th. And welcome to our residents who might be looking at this at a later date. Thanks for joining us. Let's go ahead and call I actually will do this. Supervisor Breslin is on an airplane. Supervisor Robinson is not here. Supervisor Steen, Supervisor Morehouse, Supervisor Hagan are, Dr. Hall, Mr. Lamb, and our newest member, Miss Rudy, are all present. I am going to start with Greg because I'm looking at him. And please introduce yourself. I know that you've met, but please introduce yourself to Polly, and we'll go around the table, and then we'll ask Polly to tell us a little bit about herself.
Greg with the Veterans Office, and going on 12 years now.
Hi, Polly. I'm Andrew Hagan. I'm supervisor for District 22, which is just south of here, all the way to like Burger King.
Bill Lamb. Bill Lamb, and I'm a citizen member, and I live kind of on the east side at the old East Elementary School, if you know where that is. Yeah.
I'm Dr. Alex Hall, citizen member and kind of the medical person, and I live out behind Jimmy John's.
Gary Steen, County Board Supervisor, District 5, which is Village of Colfax.
Cassie.
You need to use your mic.
Yeah, please remember everybody to use your microphone.
Cassie Schoenthaler, the Office Manager for Human Services, just as the first of the year. So just a little over a year.
And you have met Paula Winter, the Director of Health and Human Services. And have you also met Katie Gallagher?
Yeah.
All right. And Supervisor Robinson is also present. And as soon as she takes a breath, one breath. All right, we'll ask her to introduce herself. And I am Menominee Supervisor. I represent District 21 next to Andrews. And if you will, Polly Rudy, would you introduce yourself?
You bet. First of all, thank you for explaining exactly where in the community you are. I appreciate that. It helped me very much. My name is Polly Rudy. I live in the village of Colfax, where my husband and 2 children have resided for over 30 years. Started my journey in Dunn County as a social worker. Got my Bachelor of Social Work from UW-Eau Claire. Began my career working at Luther Hospital in Eau Claire as a medical social worker in the emergency room, oncology, neurology, and operational floors. Then kind of expanded my horizon and thought Colfax Area Nursing Home would be a good next step for me. I worked there for a couple of years as the area nursing home social worker, learned more about the aging population, resources available to them. Of course, you just can't stay still. So I decided to dabble in education, work for Head Start, where I was a parent visitor, parent liaison advocate, worked with children. Moved on then to Chippewa Falls School District, where I was hired as a behavioral support consultant and worked with a team to work with children with severe emotional behavioral disabilities to help get them in the classroom. It was probably about that time that I felt like I should get more background in education. Went back for my master's degree in education and fortunately somehow ended back in my hometown as a cross-categorical teacher in Colfax, where I worked with kids that were K-8 in the emotional behavioral realm. About 25 students in that classroom of all different ages, so quite a challenge. Apparently I was bored and decided to go back to school again. At that point in time, I received my certification as Director of Pupil Services and also as a principal. And I have been working as a Director of Pupil Services, covering homeless populations, special education, foster care liaison, English language learner, and I think, and district assessment coordinator for the past 13 years. So I just like to say that I'm really honored to be part of this board. It serves the clientele that I've been passionate about my whole career and just kind of combines everything that I love. So I'm very honored to be part of this committee.
Thank you, Polly. Thank you. We're really
Yeah.
honored to have you here. And obviously she brings a wealth of expertise that will certainly help us here. Supervisor Robinson, would you care to introduce yourself?
Sure. I'm Hillary Robinson. I've lived in Menominee for almost 3 years. In September, it'll be 3 years, and this is my first time as a county board supervisor.
All right, thank you. Do we have any public comment?
I did not receive any.
All right, moving on. Our next meeting will be the 25th of May. Again, that's a regular schedule. Any problem with that? Oh, yeah, slid right over that, didn't I? Any problem on the 25th? I'll go back. Thank you, Gary.
I'm away at a conference, but I'll check the schedule. I might be able to attend remotely.
Okay, all right, just let me know. Anybody else have problem on the 25th? All right, and please forgive me, we have a set of minutes from our March 23rd meeting.
I move we approve.
Thank you, Supervisor Steen. Is there a second? Dr. Hall seconds. Any additions or corrections to the minutes? I have one silly one on page 2, 8B, under financial report. Line 3. Due to this, the health department was able to purchase 2 tablets so that patients can complete their forms in the office. I think that should be staff. Staff.
It
Yes.
is a both and, actually.
Oh, both and? All right. Make that correction. Any other additions or corrections? If not, all in favor of approving the minutes from March 23rd signify by saying aye.
Aye.
Aye. Any opposed? Minutes are approved. Again, thank you, Supervisor Steen. I will do this very briefly. I don't know how many of you know that the county in September of last year launched a housing study. We are working with a consultant, West Central Wisconsin Regional Planning. The first work of regional planning was gathering a voluminous amount of data, a lot of publicly available data, census and other data. They have also conducted extensive interviews with people interested in having experience in housing, and have been analyzing the results of a survey that was done both online and in person in the community. Had about 8 or not close to 900 responses. So the data have been presented. And the next step is working on some recommendations for moving forward. Unsurprisingly, the housing study has indicated that we are desperately short of housing. Probably about 3,000 additional units by 2040. And that shortage applies to every level of income and housing need, beginning with a fairly significant unhoused and homeless population. Workforce housing for people entering the workforce, executive level housing for people seeking to move up. We have learned in the process, and I suspect most of us knew this as well, that employers are beginning to have trouble both bringing on new workers and retaining workers because there is not necessarily a place for them to live, either available or affordable. So this last week, let me just say, I should have started with that. The The Health Department Health Done Right Housing Action Team, which has been meeting for several years, used its grant support to pay for the majority of the housing study. So last Monday, in this room, the consultant met with the Housing Action Team and an advisory committee that we had formed to work on the housing study, and shared some of these data and some of what looks to be 6 goal areas and about 47 strategies that could potentially be implemented to make this work. Their next step will be finalizing those recommendations and strategies into something that they're calling a housing toolbox, which they're doing for the county as a whole, for the city of Menominee and the village of Boyceville. The final data will be presented to the county board in July, and I'll try to schedule something for us ahead of that, since this is in our purview. We have met, a number of us. We are hopeful that both the health department and the Department of Human Services will continue to be actively involved in this process. We think having a home, we think it makes more sense to put it in planning and zoning, since there are a lot of zoning implications on this, and certainly comprehensive planning implications. But the plan is to pull together call it a steering committee of knowledgeable people with interest in this area, who can help the county move forward with some practical, actionable strategies to do something about this, not just to receive another lengthy report, but to try to do something about it. So I thought I would just sort of update you on where that is. There was a bit of conversation at the last board meeting about the housing study, and it was pretty clear to me that people didn't really know what we were doing or what we were trying to do. So thought an update here at least would be helpful. Any comments or questions from the board about that? And Supervisor Hagan?
I don't have any specific comments or questions on this presentation, but I have some questions about housing in general after taking the survey myself.
Mhm.
And I was wondering, is that something I could email you?
You
Anything?
can certainly email it to me, or you could directly email Susan Badke, the senior planner at West Central Wisconsin Regional Planning. Why don't I send you her email and other contact information tomorrow in your email? Yes, and do feel free. She's always really grateful to get feedback or to respond to questions.
All right, thank you. Appreciate it.
Yeah. Any other questions? Yes, Dr. Hall.
Is the report, such as, the data that they have, such as it exists, is that publicly available?
Yes, it is.
anywhere?
And let's send it to the Health and Human Services Board. We've sent it to the Housing Action Team and the Advisory Committee, but let's get it out to the board. You want me to do that, or? I'm looking at Ms. Winter.
Okay, I wasn't sure if you were talking to me. So we do have a PowerPoint, the first PowerPoint that had the information. I haven't received the second PowerPoint. I don't know if KT did, just from this week's information.
No, not
They
yet.
will be having a complete housing study, which would be the full narrative information. That is not complete yet, but that will also be able to be available, in the future. But we can send out the PowerPoints for sure.
Yeah, the from last fall, actually, with the data dump. It's very interesting, and yes, we could get that out. So I'll talk to you about who's to send it.
Yeah, I have it. I can send it.
Okay.
Yeah,
All
sure.
right. So look for that. It's for those of us who love data, Dr. Hall. It's rich. Okay.
Thank you.
Thank you. Without any additional questions, we'll turn it over to Greg, to Veteran Services. Thank you, Greg.
Yeah.
All right, good evening, everyone. I'll start brief off with in your packet. There is a memo formatted document. I just break down local, state, federal, financial, and then kind of staff. Just give a overall summary of activities within the office. So I'll start off with locally. We've through number of months now, we've talked about the newest legislation that was passed by Congress last August. Best known as like burn pit legislation, but it's formerly known as the PACT Act. And last month, I think I'd let the group know that I was going to be doing an interview with local television. So that took place on April 4th. Yeah, I don't know how many people. I know my kids looked at it. So
I did. It was excellent.
but
A new TV personality.
right. So that really came about because of one of consultants through the county, Mr. Mel, who puts information out, and it really, I was surprised at how quick it took hold to spread information. And so it ended up being a very good marketing piece to kind of really dive down into baseline information of, hey, just get together with your local county veteran service officer and the office to talk about potential changes and benefits, which is something that we want individuals to do on a frequent basis. So that went well. And I think the end result of we did get some uptick from that. I wouldn't say specifically that number of things that have been done. So I can't really pinpoint it on one thing. At the state level, I had included in your packet a Senate Bill 102, and then just really, I don't want to say like a white paper from the State County Veteran Service Officer Association that kind of reins things in of what the association is supporting regarding that Senate bill. Basically, what the Senate bill does is expand some benefits to those that, rather than just being 100% disabled due to the military service or a surviving spouse of someone that had been 100% disabled or passed away from a condition, it's going to lower the benefit down to a 70% disability, because everything ranges in a 10% increments, and it would be prorated based upon that percentage for a tax credit.
Excuse me, Mr. Quinn.
Yeah.
For Ms. Rudy, would you please explain the property tax credit that accrues to veterans?
Yeah, so for an individual, it's on it's a state benefit for individuals or surviving spouses. They can claim a property tax credit if the service killed their loved one, or if they were in receipt of 100% disability from the Veterans Administration for 10 years. There's some other provisions if you left active duty with 100% disability and hold it for 5 years. So it's basically that protection for a number of reasons why it is a good benefit, because it can help people not get the sticker shock on being able to remain in their home. It's sometimes it's hard enough to just be able to afford the cost of things when it comes to maintenance and upkeep. So and you have to be a veteran in the state. You can't just move into the state of Wisconsin and immediately start receiving this benefit unless you entered the state or entered active duty from Wisconsin. You got to be here for 5 years to declare that residency to pay in. So they're looking to reduce that down, so to be 70% to 90% that you could receive that prorated. And it's as an example, if you own property in 100 acres, it's only the property, their primary residence, and 1 acre. So the state's not going to give you the benefit of cabins and stuff like that. So so we're looking for support. There's been traction on this piece of legislation for a while, and we'll see how this turns out. So I just included that in there for you guys' information. On the federal level, everything is really surrounding the PACT Act, and I really think, as far as initial disability claims, it's been what I've seen as a normal timeline from start to finish. We are seeing pretty large backlogs on the appeals, and honestly, sometimes what happens when you're trying to, when you have an environment that's trying to meet production goals, sometimes quality suffers. And then when quality suffers, then that increases the appeals, and then shift your workforce to deal with appeals, then that backlogs the claims. So it's been since I've been doing this particular job, it is kind of a circle where you put the focus. And right now the focus is on initial claims, because there's a lot of people that benefit from the PACT Act, which added, I think it was 28 new conditions for the Gulf War veterans that started in 1990 up through the current, and you had to have certain service in Middle East and a few other areas, and then it expanded benefits for our Vietnam veterans and Vietnam era veterans and locations, adding Guam, Thailand, and so it's all about toxic exposure from poisoning our service members. On the financial side of things, I'll go over it once I finish this part, go over the financial document that I handed out. And still there will be, I have to still get the costing done and work with HR for a supplemental grant that we received for a little over $15,000. And it goes through 2024. And I just want to be able to maximize the number of hours for the new position that we have that technically is one day a week, which we're having her work 2 days a week because we need her in the office. But once we get everything costed out, it'll easily be covered by the new grant and spill into next year. And I do have a meeting with Sarah Stabenow next week to help with some of that as well.
We'll do budget adjustment, right?
Yeah. Yeah, so just for the record, I'm not spending any money yet, even though a check's on my desk. And then staff, we got just two of us, and we've got one part-time, supposed to be 8 hours a week, but we're doing about 16 hours a week, and a couple volunteers that are on a regular basis. Any questions about that part of my report? No, but did get an inquiry for one potentially in the fall. So I'll go over the financial report, and just for the sake of the group, I'm still learning a little bit. So I'm still learning a little bit on the format of this. So I'll hit the overall summary is there are absolutely no concerns. Our budget is small, and there's limited expenses outside of salary and fringe. So just state that we're early in the fiscal year. But to just looking at again for the board, we have three cost centers. One cost center is our operating costs that handle salary and fringe, and then basic costs for the office or paper, IT related items. And we don't have any concerns at this point regarding any of our expenses in those areas. The other area, we have a soldier, technically it's called Soldiers and Sailors Relief. We have it identified as a Veterans Relief. And in that particular pop, $13,146 is our budget for that. And again, limited costs have gone out with that. We got a few requests for relief assistance. And there's no other costs that go into that. We did have a carryover that has plus that up a little bit. I think it was like $800 and some from last fiscal year, because if we get donations and they aren't spent in the fiscal year to honor the intent of those donations, we have them carried forward. The last cost center is a county veteran service officer grant, which it's based upon the county's population, and we're allowed to receive $11,000. And I actually had that check on my desk as well to be deposited. And at this point, we split a little bit with that from some training, because we have to do 16 hours of continuing education each year to maintain our access and with systems within the VA and ethics training, things like that. So we have money earmarked in there for that. And at times we'll use it for some relief if we run out of other relief funds. So at this point, just got to provide more review cost centers, and this is that quarter, so we're open at this point. Any questions about the financial review? The next section that I'll go over is our March annual impact statement. I apologize, really, I said 6 months in a row, working on the bonds. The impact statement failed. It is, yeah, I apologize. That's nice to do list. Literally, impact statement only had one in it since last month, and been a little bit training for another job I have, and annual report, I'll cover that annual report after this. So this particular 3.5 year process for a veteran. And what happens if you have an injury from service? In this case, it was an orthopedic injury, and you have surgery on that to repair. You can receive convalescent time. In this case, it was an injury back, and at surgery, convalescent time is not released to go back to work, and we can request an extension of that. And usually, based like a knee, they give you three months for a new knee. They'll pay you 100% disability for convalescent time. So a whole year. A back is 6 months. But we got that extended a number of times to the VA. Kind of started to put a halt to that because they need like 3 managers to sign off to continue it because it goes beyond their like exception policy. And they were encouraging us to file is preventing you from being substantially gainful. You did not want to do that. You wanted to get back to work. And he didn't want his employer because of confidentiality, because of small town stuff. Basically, so we had that approach because the VA contacts your employer. And so until we finally got to the end where it was 3 years, and finally encouraged him, we got to do something because it wasn't really having financial impact savings on. And so he was willing to do that. And the VA honored that. Indicating like, okay, they didn't contact his employer, didn't do any of that because they did not want the rumors and stuff, because it is a tough thing to defend that admission. So everything went through like quick. As soon as we sent the VA the right paperwork, and you can see the stress that came off his shoulders. So it was a good outcome, but you know, a lot of credit to individuals that are trying to, you know, they don't want to, they keep along. And so he was one of them. So it's good that he went that far, but the outcome turned out well. So you can see if, and I'll try to next month remember to put in a 2022 comparison back at the charts, because I think we'll see is that the contact and the records that we're dealing with individuals, the trend is always heading up. And I think we're left find where the baseline is for the number of contacts that we have. I'll draw your attention to the retroactive payments. That's the number of started tracking new system that we have. That's talked about. So real money in the pocket, and so we're keeping track of those deposits paying for residents. So you can kind of see, you know, when you start talking about the annual report, you see millions and millions of dollars. You see that it sometimes loses meaning, you know, because you're talking healthcare costs and other things. But when you just direct it, something that almost becomes more meaningful because you know spend it. Because a lot of times this is how they're surviving. So we'll continue to track that for next month, so you can look at the comparison back to 2020. What is the baseline? Is there any baseline from the that's happened? Any questions about that part of the report? Any questions for Greg here? All right, and I will include in the annual report. I apologize. Normally it's in May. Come to the human services within April. I got a request to fill a spot and see if I could do it at the last board meeting. I'm like, all right, we'll do it. And then so bring it to you now. Some of you have ever mentioned if you have a chance to kind of look at it a little bit. The approach the same way we look at federal, state, and local activities. You've heard me talking a lot about the newest legislation with the PAC Act. So my message is to forward with that legislation. It is going to be right now in the next 5 years most impactful for the Agent Orange exposed that toxin, because of how many really entitled benefits to finding some that may have had denied claims that really have benefits coming to them. So that I think is going to be the most impactful. Certainly we're seeing a lot of the respiratory related conditions for all 4 that's because of the fetal matter and other exposures to people in the Middle East. On state level, we've seen an increase in the property tax credit, and that I think we'll see that for a while. We've got a number of individuals that have through that now those surviving spouses are entitled benefits. So I see that trend continue here in 2023. And you know, and honestly, hopefully the other legislation passes, and we'll see a lot more. If you're driving around and want to put a face on it, a lot of this is our older veterans or independents that are living in those farmhouses. I mean, that's a lot of this. And so they're the ones who are land rich, cash poor. They can't put a roof on their house, but they got 100 acres out there that somebody's renting to them for pennies on a dollar. And so that's, it just got a little bit of face on that because of our rural area. That's a lot of what that is. I think the support or reimbursement we get from the VA, that has really went down a lot, that need. And I credit the VA for that. Not that people don't need the help to get the medical credit the VA in improvements with what's called community care. Before, our veterans could only go to Minneapolis for specialty care, or Tacoma, a larger hospital. And the expansion of community care, it really requires the family members to take them to Mayo or Bay, Marshfield here, or even using local service for those that live in town, and then they don't real there. So to see that as that's why I went out there for. Our veterans relief requests went down a bit as well, but because we had just every agency had massive amounts of COVID relief money. So that, you know, that's all going to be shrinking here, and we're seeing some changes with that. So I see that we have to use for some we really have to hard house veterans at times. And you know that the housing part is, you know, sometimes you can't fix a criminal background. That, you know, I think about this already. That's on there. So I'll jump into the overall budget. Health at the end, you know, we didn't overspend, and that's probably I would want the board to know that, you know, you have to maximize everything, spend out our grants because that's why they did it. So everything is good with that. I won't elaborate in detail on all that, and everything's good. I already touched on the transportation. I'll dive into this and I take up an immense amount of time. The comparison of federal benefits, that's just throwing those dollars out in my monthly report, kind of identify that real money is easy to digest this bigger picture of money. Looking at comparing 2022 to 2021, and you know, we're seeing an increase in money that's being spent. We're looking at the medical care and for HD patients are those that are enrolled in using the VA. So you know, one of 937, 964 Dunn County veterans, and then you can look at the amount of money, you know, $9.5 million up to 10 million. I say that because I think special stuff we did in the office, we're helping people get enrolled. It's really their medical needs are going to dictate those costs. And you know, it'd be great if it was 100,000 people healthy. But I think it's really healthy. Those costs are embedded in that as well. And looking at the top dollar amount, the 13,700,000 versus last year's 13,500,000. So the compensation pension, you know, we're going to be able to find kind of that sweet spot probably where it's always going to stick within, because there's only so many veterans and benefits. And so, you know, as you can see that 13 million amount, losing veterans, you know, claims get more complicated and challenging. But you know, this really just depicts that the worst get done, people are getting access to their benefits. That's expected.
That still is when it comes to that's a significant amount of resources.
Yes. Yeah. There's you can spend 10 hours to help somebody get $160 a month the rest of their life, and you can spend 1 hour to help somebody get the complexity of what you're diving into. But they deserve the access and the support systems. That's what we're going to do. Yeah, so you guys can look at absolutely answering the questions that you have. I included impact statements in the end, which are all kind of rolled up for last year, other than taking out some of the, I would say that the individualized ones that are more office specific, not veteran specific, not educational, is one of the benefits that we work on. So I'm open for any questions regarding that, or if you need further explanation in the area.
That's a question.
Kevin got Does that report catch up with you occasionally on these figures? I think it's very important that just the staggering amount of money that's brought to the county, through this department, and I don't think a lot of people realize that. It should be emphasized because everybody's trying to save money and look at the department, your budget versus what is generated. I think and you do, and it does a good job. So thank you.
Thanks for mentioning. Thank you. You two facts really, very tasteful, right for the paper, which I thought you did a great job researching. I just asked 2 questions because you watched and everything I think was said a lot because you did research. So that's a good point. I think with contacting maybe Mr. Mel to see if I can roll up the gross numbers.
And I'm encouraging the recorder and to it's nice to highlight each department occasionally because it's really educational. And a lot of people don't realize how many fingers in the county affect families in a lot of different ways. They all look at the situation different.
Yeah, there's any other questions?
Any questions for Greg? Great report.
Of course, I appreciate that.
Moving on the agenda to the public update.
So I want to share just briefly that I'm not speaking with the video with this overall amazing so I just have most going now. I'm going to highlight a couple things from that session. So you can actually know like there is people see these transformers around recall associated with the reasons including hospitals clean and also many very and nationally and internationally around Harvard is even hard to figure into different from so watching how we can learn more from it that is so that which is some sort of university so for the program you'll see there is significant information here on and door so I think we're going through with helping her to move more much less and less ability and less tourism practices. So we're basically and you can see that Grace started fantastic about using anonymized data professionals so this is kind of stable how you also in the update you see that you went through using really handy device to test that any device or distinct so using quality of analysis or using something and now I was able to able to use quality of quantity now there's there's also an to their T-test and they'll be able to use necessarily segmentation as well as if you have to test the device for when we have for things like driver therapy and then we did just a ton of outreach for focusing on place within the community including providing some education on T-test or other ways and then fantastic first year and that's how we actually health and carnival and it was just started to and it's all variety of major differences in that also in your package you see there is health secretary that's where they're putting that already at least on it you see that there were things about new licensing process and digital so we was it relevant collaboration so take that you also have something of military resource and usually the information before and hopefully we're seeing some role in cases as well so that have 2 documents in innovation and that's what's nice on the end of it and for us as attorney and you guys as volunteers as you're engaging with what's that end up hopefully and we as you have network on our DN program page we have something you can network and more information so that's kind of what our association might be. Yeah, so on leveraging our TM program is the number of items which number of deficiencies found with exceptional and I'm like, no exception low and good and exceptional low so just maybe and then number 4 are we looking at it's something in our activities that we have in the area health education center agency as for us our work even if we have to take care of stability and we will to really in the future so these things that we have we clear and we follow up and further explain like checking and others so that's something we hold our position because we now focus on opportunities to use very time to so the iteration will have for the first time and if you guys know something to sit back to and have there into focus on having an allow what is like activity we hold organizing the opportunities and
okay, with 0 questions, you might have your
absolutely. So the previous officer division in university of division and a role for meeting order of case, so I actually really learning. Now that the master's in health, and she has about 2 years of experience in global health, previous experience in and so she has been about the background. Unfortunately, she needs the statutory requirement for sorry, so with their clear operating she will start on the 15th of May and I will continue to support them as an internal police and also being her 3 years experience in local health. So I meet with their team and say was her first time Tuesday and just reinforce that I'm not enrolled until August, which one you know we're ready to maintain her position and she can fully this requirement in for next year. So there's absolutely and we are moving forward with that. I think they have a leadership structure and I'll be a new leader in the structure. Yeah. So we have like so me. Then we have this report as well. We're like that issue for the board and so we have this it's a section of the work we do. So what you have is there's actually here there's some section in the history and some of the background we don't have these and other years in this some of the sort of like what we do. So we will keep that one and define so at the end something for you and be able to questions on that in work. Question for so I have a few things I think what I think it's really important for members of the board to take note is that being household income county significantly compared to last year as it per capita income and yet the number of employees so we're seeing this increasing every right which has also significant to the overall of the county. So I thought that was really interesting and happy to see. 4 statistic that currently 67% of children under age 2 are up to date with their immunizations. I know that COVID and lack of access to and I remember correctly that the board split this against we have folks that have met that because they were being seen in their positions. We still have institutes that are insufficient are the most probably positions but it's improvement over last year. So it's all okay, and since numbers were not part of the problem is going up. Do you know off the top of your head is one of if we are seeing increased rates in the last couple of years or so far we are doing. There was a section on if I was ongoing case of and so I anything other thank you. My last question is on page 9, so the environmental health section. I was trying to talk to the super has performed, show elevated levels, and is that typical? Is that 17 to 0% typical in the entire state of Wisconsin? If you could some that would be helpful. Yeah, absolutely. Good question. So I think that if you think about something about the different areas, we do have issues with so Mary how can you pass on? It's really related to ground pass on, but the house. So you have a house there, just with we have there kind of set up with the and condition. So I think the some things required as far as new manufacturing to have passive systems installed. That's not so it can change something there. So it's important for us to test this as we on after. Something and only know when you're exposed is to test. Yeah, that's it. Just any questions for you? Okay. Yeah, another thing is on the just right here, you did see any books and just see it. Okay, there we go. So big announcement is pretty so that is my page. For the day. Thank you. So if you look at increase in access to one and increase in is really to about. Okay. The next item is the strategic plan. So I brought the plan to you last year, I believe, fall different it's looking at with a actionable strategic plan or plan. So it's not budgets. Hopefully an opportunity to we got you have 5 goals and a series of objectives to work through them. One of the goals you have heard of RC response and we know our parents are discussing as we could you meet goal 1 as a result of COVID. Goal 2 so this is where you need to put what happens to outside of their role in COVID. And so we're confident I'm not sure if it's social or Google audio you currently have at least 5 minutes expanding that springs up but all of that objectives in that extended option is how do you actually doing what you're doing with so there's goal 2, goal 3, we're professional development, make sure that we are meeting with our team and that they feel prepared and appreciated. Goal 4, minimum readiness for fabrication. So health is kind of best practice standard. There's costs associated with this number of this last time. We will not ask for funding to pursue accreditation. I do think that we need to in the next 7 years that we would achieve that minimum readiness. And then goal 5, really connecting with other funding sources as we wind down from our co-role and our co-funding, funding that keeps public health funded in our current iteration because there is not a significant amount of GPR funding from states. So we are, if you recall, all the states, I think that is something we are in bond 3. So we need to find ways to fund the work that we do and the prevention work specifically that we do. Any questions about the DAFTA plan?
Really good. What would you like from members of this board to assist or to stay out of your way?
Well, I just make sure you guys have awareness of what the strategic plan lifted up and what we're working on with that's the status of so any families that have that awareness. If there's a process of the presentation. Sure, and so I apologize if I made it well, but if you look at Wisconsin and how much dedicated GPR funding goes towards local community.
That's changed for us. We were states in the country for so that's what the awareness of that commitment.
And that's is the chair of the let's not lose this for this year's limited conduct agenda. Well, take care of yourself. You need to do yes, absolutely. So we have the picture, as you can see, and so as we've spoken before, what you're looking at is 3 months of services, and for all people in the 1 month of accountability on voting for these services in health, natural health, and others. So there's still a lot of media, but we have different things. So we picture, but it does help you very much as we have these assessments. And I was ready for the updates from this list. Any questions for the financial report? And then if you're the annual growth rate, really significant improvement, and the strategic plan is also do wish from a very fast. Thank you. All right, and so, Mr. It is up to you.
All right, thank you very much, and thank you for allowing me to be virtually. I'm down here this week at a family treatment court conference with the report team as well as family court friends. I'll have a little bit about that in the director's report for you next month, but I'm here virtually to talk about my director's report that was in your packet. And if you have any questions on that, take a long time on that, just because I know we have one presenting as well. It's just another
questions from Mr. No, it's a good report, thank you.
And then also in your package, you had a letter from the Department of Administration of Children and Families talking about health support packages and the request that colleagues really take a look at this practice of charging families when children are in care for the cost of care of the child support program. I wanted you to have the written document on this. It's more than 7 months ago or something like that. So they were starting to talk about that. We're going to have anything ready, and I wanted you to be able to review the written document that came out as we prepare for 2024 budget. It's charging health support for families that have the children not in care or not. What I plan to do is bring forward some financial information for you to take a look at with the trends of the last few years as to how to have families support that cost of care, what impact that would be not only on the department, if we do that, to be able to find ways to fund the services they provide, as well as look at and then how do you support that and fund it. So I'm taking a look at all of that. So I wanted you to have that awareness on that. Any questions on that?
So I actually have questions a little bit many. The first was, and I've just not been paying attention, but to see that ARPA is sitting on a $5 million grant to create a residential facility for pregnant women, which is very exciting and due, and data is expected to be completed in 2025. And so I have one question for you that perhaps you can answer, which is, so I would guess that a lot of the people who behind the residential facility outside of the county. Right, there's the other radius that they serve. It's not just them calling the next in their backyard. That convenience of them being right there and partner with us. Absolutely. Based on percentage, there might be increasing services to help support those families, right there, mothers. Like, I have no idea that children will come in with them or how that might impact for services in the county. I had a conversation with Director Jill Gimmons from our place regarding the first city, which is very excited about. I wanted to share a little bit of that. I think we're having that conversation with her. And we talked about ideas that she has, and I think that what they're looking at doing is some potential meetings with stakeholders such as other departments that have made as to what this could really look like with the potential of maybe having some fairly in their facility. And so I can't commit to that. It was part of the discussion on some creative things that maybe happen with this. So I'm excited to be part of that process. Yeah, it's great to hear. Lots of opportunities for partnership to help today. It's such a ability to deliver these here in town. So the second question I had was under the fiscal section of the report that you met with Representative Summerfield and Moses and talked about protection topics. And how did it go? Actually went very well. It was interesting. You kind of hear their point of view. Certainly, when you're looking at all the especially it's not very clear, and they want to be able to help support. It's also very clear that there's a pie and there's so much money in that pie, right? So you know that and navigate it. And so that's part of the discussion of prioritization. We were able to listen to our presentation and our panels we had provided specific county information, or state agency and precinct provided that, so that they had as well as the white papers. So for residents right here, it's all county, but so what county looks like, and so what that flavors them, and again, we're very receptive, even engaged very well. Okay, thanks so much. Yeah, good question. Please. Okay, the other thing that was the recovery and wellness consortium and report that was in your packet, and that is showing the work of the non-county consortium with the health CCS program. I just wanted to tell you the program, the number of consumers, the non-county service, the number of providers that we have here, the number of money that's spent here in non-county, and just as Ray was talking about bringing that money in, this CCS brings that money in to the providers and receive financial reimbursement of the services, and they are being provided in non-county bitumen and non-county. Excuse me. Questions on recovery and wellness consortium. Nice report. Yeah, and so lastly, we're turning over to Wendy for her presentation. I just really want to speak to the housing study that the housing issue has on our department and the systems that we serve within human services. Certainly, housing is a need that we each have as a community, right? And as Chairman House talked about, there's levels of different housing for families, housing for jobs, housing for our community, our staging. In that report, there's a lot of conversation about how we help us provide housing for aging in that way. Small places that are so challenging to keep up, sort of entering stairs, all those kinds of things. So we have less injuries, those kinds of things, moving from those larger homes to something smaller, and then making availability for families. But as Ray mentioned as well, we have many people that we work with that struggle with housing insecurity, that are vulnerable population, people with health, people with disabilities, people with substance abuse, families that are trying to raise children that are living in poverty, and the housing is just not available for them. We have families that I'm sure more member probably people talk about that are in school and so house surfing, they really don't have homes from home. They don't know where that's yet, but other people's houses may not even safe for them to be able to houses, but they're trying to find places. People in the vehicles, those are real situations. It's not just something that's like out there happening in some other community. That we really need to be able to support housing movement, moving the needle
individual, so it does really belong in our realm. It's not something that is mandated through the state, but it has to so we were part of the study. We were part of writing the CDBG grant to help pay for that study, and we continue to work and have support from the board and we'll see what really impacts people that we serve. With that,
There's a significant case that we need to continue to make, I think, about how critical this is. Oh, thank you for
thank you very much. If I want to turn it over to our behavioral health manager, Sonia Muir. She does a fabulous job working with not only our clinic, our crisis program, our community support program. Because of time, she's not going to be able to take the staff, the nurses, the people right in there, and so something she's doing it. She's got lots of passion for the program, very knowledgeable, and it's exciting for me to introduce her to this board tonight and have her talk about one of her programs. With that, I'll hand it over.
Thank you when you've been remarkably patient thus far. We're glad to have you. So usually I'm going to share and this email to you guys so you have a copy of it. Fill it out with this. I'm going to talk about this. We're going to need analysis. This is style, I social sorts of things. So start showing you. So we want to start with, but also like your citizens. The first thing that we want is to show certified because we work on such. Thinking about that is we need certain requirements that allows us to we know what it's not. What's the remedy? And we have to have these as part of being certified. A lot of these elements as well. So we have 24/7 health information content, equals daily and multi-face response. We try to find the best and best decision. And we're all thinking about to do that. So they send us their reports every day by next business day. I'll talk a little bit more about that one. After this one, so like this is sort of county. That's why I said you have to be health access. So about 2.5 years ago, we went to 1 million health access. So we have to be spaces. Really starting health for some reason. Health, those sort of things. Fortunate health referral for email programs. Maybe just we call it grandma. Things like that. All this out. We have cover access. So we have health access. One is just one. So they take some numbers. Allow the access folks. This house. We're crisis unit. We're able to be crisis. They're trained to do crisis response. Ability to report any ability to improve emergency escalation and well, you have to request for multiple reasons. Training on face to face process. Sometimes people are at a crisis many times. So it's business job. We know we're more prosecuting. Last thing that we do here in that we're going to do access for crisis unit ability consultation. This is really wrong. Video session way more need for special people. So like so you can see yes during some cases times. Very call here yes we're going to need. We can on the state and second screening. Another very low negative in cases are crisis. This changed a lot last couple of years. That's why we have kind of the case for bad crisis in Angel Falls. There's a few other counties that so it's kind of a ability to use that sort of thing. I'll talk about how to utilize in a moment. And then we actually have sort of the LSH. The rest of mental health crisis in a nutshell is crisis follow-ups. This is the biggest part of what the county does in relation to what I've shared so far, is every time someone has something like crisis or if we get a police report that draws attention, we do what we call follow-up. And right now, the majority of follow-up is going to have 2 calls somebody via telephone. And we try at least 3 days, 3 times in a row to reach someone. Because I'm taking the staff to reach someone, but most times we can catch them. Many times it's not that time. So we're calling them for is checking about safety, see how they're doing, see if they need any resources. And the resources are typically mental health in nature, a lot of times it's if we don't reach someone and or if we reach them, they want more information. So a lot of times it's the after crisis, they'll either email or they can mail someone materials and the last thing that county crisis follow-up does is we manage the involuntary hospitalization. So those emergency detentions and the commitment orders. So people that are involuntarily hospitalized, detained, can go for commitment and then if that ends in an order commitment order, someone we case manage that. And that's next bullet there. We do a community case manager. And at this point, her caseload is low. We're near 20. Acuity folks are really high. So it really is a community case manager. She just said yesterday she was my numbers. Actually, zero number. 20 to 30 clients is low. She's at around 20 right now. So she's low. She's working with, I think it's 20 over. Usually 20, 29. Yeah. It's like a lot. It's a lot. Yes. And the last thing that we just started to do, I think it's been the last year, is we've collaborated with Quick Response Team. If you guys have heard about it, it's an amazing program. I think of it as a correspondent model, county style. So it started with MPD and Chief Atkinson, received a grant, the behavioral health officer. And I think he was under overdose and overdose. They go out as soon as they can and they connect with somebody and check with resources. It's a team. It's a police officer, fire, and workers. We are collaborating with them and we're part of that team. So it's really cool. Any questions so far about mental health in a nutshell, mental health crisis in a nutshell? I've got data coming. Any questions for Ms. Winger? Go ahead, please, Wendy. Go ahead.
Their department has done exceptional work for us. And I'll even name, since Wendy became manager, now it's Madison, that has numerous times when we've had veterans in crisis to ensure that there's a plan, that the professional setting, that they're in a good spot and making sure that they have resources, and as well as the police department, they've stopped in as well, because unfortunately we've had a couple veterans that have got involved in some things that aren't good. But yes, it's incredible. You can't quantify how much money you save when somebody doesn't have to go on hold.
Thank you.
You might be able to.
Yes.
I can.
So a little data, which I find always just amazing. So total crisis calls. So this is everything together when we think of mental health crisis. On the right side, you can't move Paula there, but 2021, 1,095 total crisis calls that somehow Dunn County Emergency Mental Health Crisis touched. And then it notes by month, and that's what's on the graph. It's just interesting to get a little out there. In 2022, we had a little bit of a decrease. I don't know why. If I'm 100% honest with you, I don't know why. One would think it would have been higher last year with the pandemic coming to an end. I try to make all sorts of hypotheses about crisis and I can't. Sometimes it's the moon, sometimes it's because the chicken tastes different. If you look at this though, at the graph, red is 2021, blue is 2022. If you look at the fall of 2021, so that was right in the midst of the pandemic, right? Because we were just coming out in 22, that fall time was spiking numbers. June though consistently has low numbers, which I'm always like, that's so cool. That's when I was born. Yeah. Also low in February. This year, April has been incredible. We've had a lot. It's just been really high numbers. So it's an interesting slide. Next slide, age. Is there a way we can move Paula? Is that on here? It's okay. So just some data. When we think about mental health crisis, and we're looking at this on the right, that is a different number, but bear with me. So 2021 total calls were 1,149. Of those, 16% were adolescents, so 8% were adults, 1% they didn't share, they didn't know. And then it kind of breaks it out. How many telephone, mobile, the DHS is if they walked in and they did an assessment here. Video, we had a project and that was in the midst of the pandemic. They were trying to catch on. I don't know why. I have some hypotheses. Police reports. So if one comes in, we make a clinical decision if we should be doing follow-up or not. So we did 2 follow-ups there, and then
telehealth, which Kelsey put this together for me, and I don't really know, but, oh, I know what it is. Ha, see, I just told myself. In St. Croix County, they have a pilot. I think it's still going on, where the hospitals, I think there's 3 or 4 hospitals are part of this group where they do the crisis assessments at the hospital rather than Northwest doing them. And they also have a DHS 34 certified program, even though they're not county. So that's what that is. Why is that on our numbers? Because it was a Dunn County resident that presented in St. Croix County. Yeah. So when you compare that to 2022, increase in adolescent crisis calls, 81% adults and 5 unknown, which doesn't even, it's like less than 1%. And then you can see in 2022, we've had 5 of the QRT, we call them deployments, that we've been able to go out with MPD. The graph, I think, it's kind of a cool graph, I guess. But if you look in 2021, there were more adults using the crisis line, less adolescents. In 2022, it's been less adults, more adolescents. I don't know, it's kind of cool to look at how many more adults use the crisis line. Next, so this one has a lot on it. Let me try to summarize this. We always, whenever, so I've been in crisis for almost 20 years, not myself, but working in crisis for 9 years. And our biggest referent, so this is the caller of crisis. So who is the person initiating the crisis? It's always the person themselves in crisis, which always is what we want. We always want the person to be calling, say, hey, I need some help, or can you help me with this before it gets to someone else? The second is the police, which makes sense. MPD, DIZO, Dunn County Sheriff's Office, that makes sense. They have to engage Northwest Connections or the county if they're looking at an involuntary hospitalization. It's a collaborative decision, so human services and police have to make that decision for a number of reasons, so that we make sure there's an assessment. The county's responsible for all sorts of financial things and all that good stuff. So that's yeah, if we look at the graph here, the graph really shows that the self, the person calling is the highest. Second on the graph is MPD, and then DIZO. I always find that interesting that MPD is the highest, but when you think about that, the hospital is in town. I'm going to keep going unless you guys have any questions.
Just a real quick one on the referrals for, I think you just mentioned referrals for emergency detention. It would be with your department of human services and law enforcement, or perhaps, or maybe just what, but is that new with your involvement? I know, because I used to work as a lawyer and I did a bunch of those, and a lot of times human services handled on their own, but then it seemed like there was a period of time when just law enforcement was doing that, had the ability to do that without any other collaboration. I may have that.
No, you're totally spot on. So let me give you what I know. So it's a mental health crisis is somewhere back, maybe 2008. And at that time, it was the police doing what they could to sort of, I don't know, assist, intervene folks that were in a mental health crisis. And at that time, they had the ability to do emergency detention police. What happened? We started to see the fill of hospitals. And then someone would really need hospitalization and all the hospitals were full. And it was like, well, what do we do? And so they ran into a lot of concerns. I think it was, I want to say, I said 2008, it might have been 2008 was when the statute changed. So it's DHS 51, where they changed the statute and they said, actually, to approve an emergency detention, it has to be the collaborative effort of police and human services. So they have to do it together. So it's like they do it together, but police execute it. So it's a collaborative joint decision. Police can still execute. At this time, police can still do a detention independently, but nobody's real happy about it. And so we have police detention independently, I think in 3 or 4 years, which is really good. I think that shows that we really have a good working relationship with the police and they really appreciate Northwest Connections. And we've done a lot of work. So as much as I wish it was me that made that change, it wasn't me. Yeah, absolutely. Any other questions before I go forward?
Any other questions? Go ahead, please.
We did this one. Okay. So I don't know if this is the last slide. Sorry if I misspoke. So I always think emergency are really interesting because many times we don't have any control or say with what happens with these, right? Because they're happening late at night. Police are doing what they can. Resources are limited. So I always think it's important to share these. So 20 emergency detentions, 56 adolescents, 56 adults, 8 adolescents. And then it goes through on the side many different things that are just different ways of saying involuntary hospitalization. So a director's hold is what happens when someone's on the leave and the doctor doesn't think they should leave, or is implementing an emergency detention. It's just a different way to say it. Moved to more restrictive is when someone's already on a commitment order and they either go to the hospital and they want to leave, and or they're in the community and they're not meeting the requirements of their order, and or they're dangerous and they won't go voluntarily. Then we do a move to more restrictive, and that's essentially similar to an emergency detention. 3PP means 3-party petition. Like an emergency detention, but 3 people, someone fill out a petition saying they will be, they'll go to court saying, yes, I think this person's dangerous, and yes, I think they're mentally ill. We had 0 of those in 2021. And then a 5145 is incapacitated by alcohol holds. Human services doesn't need to be involved with those. Police can do them on their own. Kind of the interesting variable about a 5145 is the hospital doc can release someone. So many times it depends on sort of how the person's interacting or how they're presenting. And then if the police didn't give us a heads up, they don't have county follow-up. which is pros and cons. Medical treatment is when someone has contact with Northwest Connections and maybe it's like an overdose, they go to the hospital and the end result is medical treatment. And then from there, county crisis follow-up takes over and they check in with the hospital, determine what to do next. And then the last one is voluntary hospitalization, which I think is interesting. So we can compare those numbers. The chart does really being these emergency detentions. We had more in 2022 than 2021. Voluntary, I think, is still pretty high, which makes me happy. And then it just goes down, which I think it's just an interesting graph to look at. Any questions about this one? Yes, ma'am. Dr. Hall.
So where are most of these hospitalizations occurring?
Awesome. Look at this.
Yay.
Hey. So this kind of happy and sad. So if you look at both, we primarily, and there is no rhyme or reason, there's a list of hospitals that it's primarily Northwest Connections looking for our hospital beds when they're doing these. And they have a list that we created, which is uncounting the middle of the radius of all hospitals on the inpatient unit. And they run down that list when they're looking for hospitals, and either they have space and they're willing to take this person, or they're full. And there are other times they have space and they're saying this person's not appropriate. We're lucky, it has been for many years. And the part that makes my heart sad is Winnebago is second. Sacred Heart comes in third, which I don't know why. Last year, I know Sacred Heart had some, we just talked about this at the crisis meeting a couple months ago, but they had some issues with their admission systems. They're having some difficulties getting admissions, but they also are adolescents. They're our closest adolescent inpatient unit. So hopefully we'll see that change because they got in the building and adding that much hospital beds, both for adults and adolescents. So yeah. That is one thing I didn't add to the beginning. One of the other things that we have to do for DHS 34 certification is have a county crisis stakeholders meeting. So we have anyone that touches mental health crisis. And I really pride that meeting. We probably have 30 different entities attend that meeting, from police to hospital to providers. It's really a good communication meeting just in discussing emergency mental health crisis. You know, any other questions about this slide?
Yeah, Ms. Rudy, please.
Speaking in general about the youth that are going to like Winnebago and out of county, is there any kind of collaboration that when those youth are leaving those facilities and coming back to our county that they're contacting back to home?
So Winnebago is, okay, so Winnebago is always involuntary. So whenever there is an emergency detention, the county is doing that case management. And part of that is, hey, what are we doing? What's the status? What are you thinking about? What's it look like? We found that there's a lot of variation in hospital sort of discharge planning, if you will. Sometimes it's amazing. Sometimes it's the family isn't engaging, that sort of thing. So yeah, our unit, which is Kelsey and Madison, they really work to help case manage, talking to the hospital, talking if it's an adolescent, talking to the family. And then no matter what, when we find out they're discharged, which we are aware of because we have to help with that, if it's transportation, and calling parents are like, hey, we don't want to talk to you, we're mad. Sometimes they're on a commitment order, and then we're meeting with them when we're figuring out how to go forward. Yeah, for sure.
Go ahead, please.
This is actually the last slide. So move to the person being on an involuntary court order. Typically, you hear it called the commitment order. Sometimes they're a settlement agreement as well. In 2021, there were 64 EDs. 17 of them went to what we call probable cause, or in other words, 26%, about a quarter. On the bottom part, it explains there was 11 commitment orders and 6 settlement agreements. What a commitment order is more intensive, if you will. It's a 6-month order for 2 terms. A settlement agreement is a little more voluntary. It can be less time, no more than 3 months, and that firearm restriction isn't included. Those are the 2 biggest variables that are different.
Is not
included with a settlement agreement. There are a number, I'll go through this before I kind of give my thoughts. In 2022, a little bit higher of a percentage went to court, and there were court orders that resulted, 9 commitment orders, more settlement agreements, 13. And then 1 was a 5554, which is protective placement guardianship, so more of the APS realm. So it's still, when I look at this, sometimes I'm like, so in 2022, 1/3 of our emergency detentions went to court. Does that mean they're not appropriate? What does that mean? It's always hard to kind of look and say hindsight's 2020. I really think whenever the police and Northwest Connections do an emergency detention, it's necessary in the moment. Many times that event in itself is enough that someone, on occasions, they felt so stigmatized that they didn't go into the hospital, those sort of things. So I just kind of look at these and I'm like, okay, I like to see the number raise of the folks that do end up on orders, but I would really like to see just more resources, I think, and that ability to get help before it's to that point of crisis. Any questions about this slide? Yes, ma'am.
The recommitment, so are those folks who were on a commitment order and then at the end of that 6 months or something, it was determined that they still needed some sort of ongoing restriction?
Yes. So I wish I had more data on that. So if we had 20 people on a commitment order, the initial one is for 6 months, and then we can extend for a full year. The person will talk with their attorney for less time, those sort of things, sort of like, hey, I'll agree to this, but I want less than a year, those sort of things. But yeah, so there were 24 of those recommitments that it wasn't an initial commitment in 2022.
So my question is, readmissions for mental health. So kind of in the medical realm, like you look and you see, okay, this person was admitted for a heart attack, and then, 3 months later, they're back in the hospital with a heart attack again. Is that data that you collect about kind of people who are repeatedly entering the system, repeatedly, emergency detentions? Is that something that you quantify?
We do. I haven't put it into that specific, but yeah, definitely we do. And I can think of like more chronic, and many times we see that escalation of, okay, so we're seeing chronic police contact, starting to see chronic Northwest contact with police are calling Northwest, and then maybe chronic emergency detentions. So you're right, that would be a great number to quantify.
Please, Supervisor Robinson.
When you say they're not appropriate, what does that mean in this instance?
Can you remind me what I said?
Yeah, you said, I forget what you were talking about, but when they went to court, the reasons they went to court, and you said, is it because they're inappropriate or not appropriate?
Yeah, I know. Yep, I know what I said. So if I looked at this and I didn't work in mental health crisis, I would say there were 64 emergency detentions and only 17 went to court. Well, we'll just say the number's 40. 40 emergency detentions shouldn't have happened. Like they weren't an appropriate emergency detention. Like did that person need to be detained? That's what I meant by not appropriate. I believe that they always are, the police in Northwest. Yeah.
Dr. Hall.
So I'd just like to, as somebody who worked in college health center, sometimes those 3-day emergency detentions are absolutely what somebody needs to kind of like bring things to a head, get them into services, get them associated with resources. I certainly wouldn't say a low percentage of people then needing commitment orders is in any way a reflection that they weren't appropriate, because that intervention in and of itself can be very beneficial. Yeah.
We've been 8 years thinking, and our percentage going to court was much lower, and the emergency detention numbers were higher. I think somewhere in the 100s, 120s or so. So there's been a lot of progress and a lot of work just on the state's end of creating the statutes to be more restraint-based, ensure there's a crisis center, just make sure that we are meeting people's needs, and least restrictive is always there. So like if the person's willing to go voluntarily, you can't do an emergency detention, which is cool. Yeah. Yes, ma'am.
Dr. Hall.
So one last question. I know we have talked before with Human Services Department about, I think it's when folks go to Winnebago, the county pays for that.
Yep.
Which is that different if they go to Sacred Heart, or does the county pay for all emergency detentions, or?
That's a good question. So by statute, the county is responsible for involuntary hospitalizations. What's very good is all hospitals will bill insurance first. Now, Winnebago, yep, we are responsible, but Winnebago is funding for it. So, and then there's this interesting caveat, which I don't know where it comes from. I think it's 21 and below, they pay more, and then it's 60, that magic number, 62, 67, they pay above. Anything in the middle, the county pays pretty much, I think it's 100%. We don't pay the full amount of Winnebago, we do get some kickback. It's usually after the fact. So, yeah, so Winnebago does cost the county more. Yeah.
So then just follow up with, if Sacred Heart has more capacity than there, that would be helpful for everyone.
Yes.
Because who wants to be far away from their family? And
Yeah, saves transportation costs.
Yeah.
With law enforcement time.
Right,
And
so
all of
it's
that.
very
Thank
exciting
you
that
for
they're,
Winnebago.
Yes.
that they're expanding this.
Yes, absolutely.
Any other questions? This was fascinating and interesting.
Thank you.
Thanks for a very good, thank you for a very good presentation.
Thank you for having me.
You can come back if you want to. Anything else?
No, other than the financial reports. Okay. Can I move forward with that? Okay. Let's start with 2022 financial reports. This should be our last one. You will see that, and just to kind of take a couple months after the end of the year to receive all of our bills and to receive the funding that we have due to some of the funding. You have to build the grants or the programs. They have to be received by the grant, reviewed, and so it's 2-3 months late in a row as well. So why it kind of trickles in until we're getting kind of here. I'm sure you can be pretty solid with this number. So this is the summary for 2022. 11 million, and we received 3 million in tax levy. Our expenses are divided by staff salary and fringes. 8 million there and 6 million for the operation. So like Wendy was talking about the hospitalized things for the operation. So at the end of the year, we are to the good at $336,670. And as a reminder, that goes back into the general fund to help with anything they would need for funders. So that is any questions for me in that.
Any questions for Ms. Winter? Yes, Dr. Hall.
I'm just on fire tonight. Sorry. So I had a question about in terms of the anticipated budget for operational and then actually total. It was quite a bit lower than was projected. And so did we have fewer hospitalizations that we were paying for? Did you have fewer? I don't know. What are the other things that are so some of that kind of foster care and those types of placements? Are those the types of things that are so hard to predict that might be why that number was so different than anticipated?
You got it. Right. So the children in care. So we budgeted for residential for children and group homes, and the staff worked really hard to be able to find family placements. So what we call kinship or concurrent planning, like foster homes for children. And so those are quite a bit cheaper than the residential or group homes. And so that is really challenging to know. I can tell you we have somebody at a residential right now because we needed an extensive medical evaluation on a youth. It was having quite a bit of psychotic So not only the community safety, and so, you can't predict that. And so that's where we are in 2023. And, I know that there was an individual here in 2022 that also was in the time, and that was unpredictable as well. And it was somebody that was in the family care placements with family care and was on radar, and then they go to the hospital for payment. And so we really we try to partner with them and work with them to be able to help get that individual help. It's really kind of out of our control because it's not our case management to do anything with. So we just tried to move the shells around with the finances to see what we can do to cover it. But we had some ability to do that in the last year to be able to end up with $336,000 to the good.
That, with all the, I'm sorry, I don't remember the appropriate term, but kind of the in-home or the family placements for you, which are only just less expensive, but often less traumatic, more appropriate for the child and the family. So
sure. There's also actually more work. I could spend a lot of time talking about that, but it's a lot more work to find family members and to help support them. Because a lot of times they don't have those expertise, like a foster parent maybe that's trained or a group home. So it's a lot more work on the workers. And so I really appreciate the work. It reduces trauma for children and also the cost. Something we should add. Yeah. So that's that one. Any other questions on 22? Otherwise, I will pull up 23. Where did it go? No, it's not on my share screen. You had it ready.
I don't know if it's relative to 22. So I don't know if that's on the document itself. So I don't know if that's why it's making it difficult for you to find it.
2023 one does?
Yep.
Okay.
I don't know if that's how it shows up in the document.
Okay. Let me go back to the, sorry about that if it's spelled wrong. Okay, what's that time? Projected. Okay, I think I got it here now for you. Back to share. All right, so this is the 2023 one, and as Katie described with hers, and it's hard to project, based on that, it looks like we have a lot of money, but we have to, these budgets depends on, we go through a monthly document and try to project things out, so something's a one-time cost that we don't project it for the whole year, or something that we project for the whole year to make sure that it's in there. So on this guesswork at the same year, I'm looking at good for 648,000, but again, I don't go, there's no guarantee on that one, because we're so new to the year. Any questions on this?
Supervisor Station, any questions? No questions. Good job.
Right, thank you.
All right, thank you. Couple of action items for us to consider, and this next one, with our budget, much DHS vouchers page. If you look in the supporting documents folder, it was like 160 pages. But if you, but if you went to the DHS folder that Cassie so wonderfully sent, it is a reasonable document. But just in case you didn't want to go through the 80 pages, the amount of the document, this is kind of our checkbook, right? These have already been paid. And we're not approving them, we are reviewing them, we're looking it over. The amount was $955,350.60. But the supporting documents, well, you had to dig for that amount. So I need a motion to note review of the, yes, Mr. Lamb?
Since I printed it, in honor of Larry, I will make that motion.
Any questions? Any further discussion? If not, all in favor, say aye.
Yeah, our old, way of presenting it.
The former way?
Yeah.
Be more specific, they look like this.
No, they look like this, where you got it,
Oh, right. Cassie and I talked about that. We'll try to fix it. See it. And I should go into the DHS separate folder in the documents that Cassie sent a week ago. It's formatted appropriately, but you go, basically you have to go to 2 places to get it.
Cassie, if you would, dumb it down for me, will you?
All right, all in favor?
Aye.
Any opposed? Okay, and our final, excuse me, action item is the budget adjustment for human services. Mr. Lee,
Yes, certainly these are grants that we received in 2022, and they are carryover ones that we want to make sure that we have for 2023. The one that I wanted to post your attention is the new sex trafficking grant. This was a surprise to me and to the financial staff. We received $10,000, and I had to call the state to ask for that. And how funny is that in our tracking system for electronic system, the workers check a box that say this was a child that had been involved in sex trafficking and needed placement. This is the amount of money we spent in placement in 2022, and they reimbursed us in 2023 for that amount. So that's what that is, that new sex trafficking grant. Other than that, there are grants that are being carried over or short up because they changed over the period.
Does that make sense? We see budget adjustments fairly frequently. It's kind of either the amount changed or there was a new grant, and it just needs to be added into the financial system. Thank you. Dr. Hall, seconds. Any further discussion? All in favor?
Aye.
Any opposed? Budget adjustment passes, and we'll move forward. And unless anybody has an announcement or some wisdom to share, anything, we are adjourned. Thank you all very much.
Good night, everybody.
You on
Good night.
May 25th.